Rest and ice are making your plantar fascia worse, not better. If you've been limping around for months avoiding activity and icing your foot every night, you're doing exactly what keeps plantar fasciitis from healing. Your foot needs a load, not rest, and I'm going to show you exactly how to fix it. I'm Dr. Ethan Kellum, one of the orthopedic surgeons for the Tennessee Titans and USA Basketball. I treat plantar fasciitis every single week in my practice, and the patients who recover fastest are the ones who stop resting and start loading their feet correctly. Exactly 1 year ago, a 52-year-old marathon runner came to see me with plantar fasciitis that had completely derailed his training. He's been dealing with the heel pain for 8 months, and it kept getting worse despite doing everything that his physical therapist and his primary doctor told him to do. He rested for 2 months, he iced his foot twice daily, stretched his calves religiously, and wore a splint every night, every single night. The pain would improve slightly during the rest periods, but the moment he tried to run again, it came roaring back within the first mile. His podiatrist told him to take more time off and to consider a cortisone injection. When I examined his foot, the plantar fascia was tight and painful, but the bigger issue was obvious the moment I watched him walk. His arch collapsed completely with every step because his foot intrinsic muscles had atrophied from months of rest and offloading. He had been treating plantar fasciitis like an injury that needed rest, when in reality, it actually needed progressive loading to rebuild the tissues that support the arch. We threw out that rest and ice approach completely. We started him on a structured loading program with eccentric calf raises, intrinsic foot strengthening, and gradual return to running using a walk-run protocol. We also used PRP injections to jumpstart the healing response, stem cells to promote the tissue regeneration in the most damaged areas, and exosome therapy to deliver those growth factors that accelerate the healing. Within 6 weeks, he was running pain-free for 3 to 4 miles. At 3 months, he had completed a half marathon with 0 heel pain. He sent me a race photo to prove it. And he even looked happier than the photo than some people do on their wedding day. And honestly, after months of the heel pain, I get it. That is the difference between treating plantar fasciitis like a tissue that needs protection versus treating it like a tissue that needs rehabilitation. The most common pushback I hear when I tell people to load their plantar fasciitis instead of resting it is this: how do I know this approach is legitimate science and not just going to make my pain worse? It's a fair question, and I'm going to give you a direct answer. The evidence for eccentric loading protocols in tendinopathy and fasciitis is extremely strong. Multiple randomized controlled trials show that progressive loading combined with strengthening exercises produces better long-term outcomes than rest, stretching, or orthotics alone. The biology makes sense because tendons and fascia adapt to load by getting stronger, and they atrophy when you offload them for too long. Resting might give you short-term relief, but it does not address the root cause, which is that your plantar fascia and supporting muscles are not strong enough to handle the load that you're putting your foot through. Where I think skepticism is warranted is in the gadgets and gimmicks that promise to fix your plantar fasciitis without any real effort, like a magnetic insole, miracle creams, and devices that claim to cure it overnight. Those do not work because plantar fasciitis is not a quick fix. It's a rehabilitation process. The treatments I use, like progressive loading and regenerative injections, are backed by clinical evidence and used at major academic medical centers for exactly this condition. Come in and let us build a plan that actually addresses why your foot is not healing. And if you have been dealing with plantar fasciitis for months and it's not working, I created a free guide that walks you through some of the earliest steps to get you back to running, walking, and standing without pain. The link is down below. Now let me explain what plantar fasciitis actually is and why most treatments fail. Plantar fasciitis is inflammation and micro-tearing of the thick band of tissue that runs along the bottom of your foot from your heel to your toes. This tissue, called the plantar fascia, acts like a bowstring that supports your arch and absorbs the shock when you walk or when you run. When that fascia gets overloaded beyond what it can handle, it develops tiny tears and chronic inflammation, which causes sharp stabbing pain in your heel, especially with the first steps in the morning. The reason morning pain is so classic with plantar fasciitis is that the fascia tightens overnight when you sleep. And when you take your first steps, you are re-stretching damaged tissue that is stiffened up. Imagine an NFL kicker trying to nail a 50-yard field goal in freezing weather. The ball is rock hard from the cold, so every kick hurts more than it should, and the kicker has to warm up slowly before attempting full power kick. Your plantar fascia is the same way in the morning because it's stiffened overnight, and you're asking it to absorb full load before it's warmed up. Plantar fasciitis is not a sudden injury like an ankle sprain. It's a chronic overload condition that builds up over weeks or months. Common causes include increasing running mileage too quickly, standing on hard surfaces for long hours, or wearing unsupportive shoes. Tight calves and weak foot muscles also contribute because they can't support your arch properly. One condition that often gets mistaken for plantar fasciitis is tarsal tunnel syndrome, which involves nerve compression near the inner ankle. Tarsal tunnel causes burn burning or tingling pain along the inside of your foot and heel, whereas plantar fasciitis causes a very sharp, stabbing pain directly under the heel. If your symptoms include numbness, tingling, or pain that radiates into your toes, you might have tarsal tunnel instead of plantar fasciitis, and the treatment is completely different. If you want a full breakdown on tarsal tunnel syndrome, drop a comment below and I'll make a video. Getting the diagnosis right matters because treating nerve compression like fascia inflammation will not work. Here's why the standard advice to rest and ice your plantar fasciitis often makes it worse in the long run. Rest reduces the pain temporarily because you're not loading the damaged tissue, but it's also causing plantar fascia and foot muscles to weaken and atrophy. When you finally try to return to activity, your foot is even less prepared to handle the load than it was before, so pain comes back immediately. Ice reduces the inflammation short term, but inflammation is part of your body's healing response. By icing constantly, you are suppressing the biological signals that tell your body to repair that tissue. Picture a basketball player who only practices shooting but never works on ball handling or defense. You might get better at shooting, but you are not becoming a better overall player because you are only developing one skill. Your plantar fascia is the same way without progressive load that challenges it to adapt. It cannot strengthen and heal. The smarter approach is controlled loading that gradually builds the tissue capacity without overwhelming it. Now, if you're watching this video, you are probably wondering what you can do about this. Well, here's what you can actually do about plantar fasciitis today. First, stop complete rest and start moving differently. If running hurts, switch to walking or cycling temporarily. If standing all day hurts, take sitting breaks every hour. Second, rebuild the tissues that support your arch. Eccentric calf muscles are the most effective exercises for plantar fasciitis. Stand on a step with your heels hanging off, rise up on both feet, then slowly lower down on the affected foot. Do 3 sets of 15 reps twice daily. Also strengthen your foot intrinsic muscles with exercises like toe curls, marble picks up, and short foot drills. Third, you want to stretch those tight calves because they increase tension on the fascia with every step. Stretch for 30 seconds 3 times daily with both knees straight and knees bent. Fourth, consider regenerative treatment. PRP, stem cells, and exosomes all promote tissue healing and reduce inflammation. These work better than cortisone because they actually repair the fascia instead of just masking the pain. I've seen way too many plantar fascia ruptures from repeated cortisone shots to ever recommend them. Fifth, you want to use supportive shoes or orthotics temporarily while you rebuild the strength, but do not rely on them forever or your foot stays weak. And finally, if you're going to try magnetic insoles or miracle creams that promise to fix this overnight, just Venmo me the cash instead. At least I would tell you up front it does not work and it will save you on shipping. A big question I get is, how do professional athletes handle plantar fasciitis? And the approach is completely different from what most people do. We do not tell them to stop running for months. We tell them to modify their training load while continuing to run. That might mean cutting weekly mileage by 50%, doing more running on soft surfaces, or switching some runs to pool running to maintain fitness without pounding the fascia. We also monitor their training load weekly to make sure they are not ramping up mileage too quickly. Look at how Steph Curry has played at an elite level for over a decade without any major injuries. He did not get there by maxing out every practice and destroying his body early. He got there by managing his training load intelligently so his body could actually sustain performance for years. Your foot works the same way because smart progressive loads build long-term capacity, but doing them too much, too fast, breaks you down before you reach your goal. Elite runners also use recovery tools aggressively, including regenerative injections like PRP, stem cells, plus red light and massage to keep blood flow moving through that fascia. They do not wait for pain to become unbearable before addressing it, which is exactly what the marathon runner did for months before he came to see me. And those months cost him an entire racing season. So now that you know what to do, let me tell you what happens if you ignore this and just keep pushing through the pain. Those micro tears in your fascia, well, they accumulate. The inflammation becomes chronic, and eventually the tissue degenerates. Chronic plantar fasciitis can lead to heel spurs, which are bony growths that form where the fascia attaches to your heel bone. Heel spurs do not cause pain themselves, but they are a sign that your fascia has been pulling on your heel bone with abnormal force for a very long time. You also start compensating by limping and altering your gait, which overloads your knees, hips, and your lower back. I've seen people develop knee arthritis and lower back pain from months of limping due to untreated plantar fasciitis. The earlier you address it with proper loading and rehabilitation, the faster it resolves. The longer you wait and hope it goes away on its own, the harder it becomes to fix. Plantar fasciitis does not heal with rest and ice. It heals with progressive loading, strengthening, and addressing the root cause of why your foot could not handle the load in the very first place. Stop avoiding activity and start rehabilitating your foot the right way. The guide I mentioned earlier walks through some early steps I use with runners and patients to get them back to pain-free movement. The link is in the description below.